Hey everybody, I'm Dr. Seiler, and I want to help you transform your practice by changing your thought process and your approach to your patients, especially when it comes to injectables. I want to introduce to you GravityPhiX, a new method that I've been using for years that may seem new to you, that uses neurotoxins to help defy gravity, using the 5 proportions of the face and treating 10 areas of the face and neck with Botox. This may seem new to you, but I've been doing this for years, and I'm always surprised when I do injections all day long that patients commonly come to me having had some neurotoxins and fillers before, but almost never do they know about neurotoxin use in the lower facial areas and even the neck. I've been doing this for a long time and have realized that the cause of a lot of the symptoms in the lower face and neck is actually muscle movement and not just volume loss or the need for tightening. So I've really changed my way of thinking over the last couple of years. We used to always think of the lower areas of the face as only an area where you would put filler, try to lift, do different laser procedures, or even need surgery. And what I've proven over the years in my practice is that a lot of the cause of the symptoms that patients come in for later in years is actually because of movement that you can reduce, you can treat, and you can even prevent. So think of this. Think of your 20-ish-year-old patient that comes in. They know they need Botox in their upper facial areas. These are pretty commonly thought of areas of movement that cause lines. Younger patients are getting smart to know that they can prevent that by coming in for small dose Botox treatments to prevent them from getting lines down the future. What we realize though is that later in years, patients typically come in with a lot of deeper line symptoms, wrinkles around the mouth, perioral lines, pulling down of the corners of the mouth, and even neck laxity. And traditionally, like I said, we've always treated this with tightening procedures and filler, but if you treat these patients' muscles with neurotoxins, not only can you help treat them when they come in, but you could have prevented it years ago. You're going to see in our patient today, a patient in her mid-40s that's gotten some neurotoxins in the past, but she's never been told that neurotoxins can be used in the lower face. So I've really become passionate over the years about helping to teach practitioners to change their thought process. This helps you get much better results for your patients because you're going to be addressing the cause of the symptoms and not just filling the area or trying to tighten the area. You can put all the filler and all the tightening procedures you want all day long in a patient, but if you're not treating the cause, you're not ultimately getting a good result. And it can also help make your injectable practice much more profitable. We always, want to make more money per time, and the way to do that is not to simply add more units to each area of the typical upper facial areas and potentially make the patient cosmetically unhappy. The way to do that is to actually add all of the other areas to increase your profit margin per time, but ultimately make your patients much happier because you're treating their cause of their symptoms, and they'll keep coming to you forever. So join the group of learning about GravityPhiX. We're going to do a little demo today. We're going to explain on a patient the basics of this procedure, and you'll see in our online and hands-on courses that we really teach you to change your thought process and how to more properly and more thoroughly treat your patient. All right, so one of the most important parts about changing your approach to the patient is making sure that you do a thorough consult with the patient, even if it's just for neurotoxins and or filler. You always really want to determine what the patient's symptoms are and what the cause of that is. So I'm going to have Kristen here kind of take the mirror, tell us a little bit about what her concerns are and what she's done, and then we'll kind of go through my quick consult process.
So concerns now are more crepiness here, a lot of laxity in my neck,
Okay.
not quite as a defined jawline. I've had injections in the past. No one has ever approached this, so I appreciate that you are doing that now rather than just throwing filler into my face.
Right.
So you're actually correcting the movement, which is actually causing the problem.
Right.
I love that you address this area because as we age, I do feel like gravity is pulling down.
Right.
So GravityPhiX, bringing it up, is a perfect technique that no one else is using.
Right, and we've done this twice in you, I think, now.
Yes.
We've also done Fraxel in the past, and it was interesting that when she came in, she had pretty noticeable lines around her mouth, honestly. And she had neurotoxins before with other providers. No one ever suggested that to her. I believe you've had a little bit of filler around your mouth years ago. And what we really determined was most of what she saw around the mouth, because she's got great structure to her face. That's one of the things that you need to look at is the 5 proportions of the face. She's got great cheek structure. She's got good jawline structure. If you look at her in profile, she's got a good E-line, which is something I teach in our courses, good chin. but around her mouth really was all movement lines. There really was no need for filler. We haven't done any filler in her in my practice yet. We're going to do a little bit in the future. But you really have to look at the muscles and realize that most of the time your vertical lip lines, your upper and lower lip lines, and even the downturning of the mouth, the beginnings of jowls, is all because of muscle movement. It can be because of volume loss, and sometimes you need to include filler, which we teach, and sometimes you need to do laser procedures or tightening procedures. But again, if you're not addressing the cause, you're not ultimately helping the patient get to where they want. I will tell you it's probably the hardest thing to convince your patient to be willing to let you do. Because no one's ever told them about it before. So you really have to spend the time educating them and show them in the mirror. So after, what I usually do is I get them to hold the mirror and show where they see their concerns, but then I show them where their movement issues are. I get them to fire their DAO, for example, and when they see for themselves how much they can fire that muscle, that's an example of proving to them that the cause of that kind of jowling, as we call it right there, is just as much muscle movement as it is the need for volume and tightening. So again, I think, if you really do a good thorough consultation in the beginning and set up the whole process, you'll really educate your patients and they'll believe you and they'll be willing to try some of these new ways of thinking, and you'll get better results. Alright, so we've just completed our GravityPhiX treatment, treating all 10 areas of the face and neck with Botox. You can use whatever neurotoxin you're using for this. You can see that she tolerated it really well. She's not just faking for the camera. She did great with this when we injected her. We did use our AccuVein to show us some of the areas that are more vascular so that we don't have any bruising. You can see that I did multiple injections through the 10 areas and she doesn't have any area that barely bled since we avoided all those vessels. She tolerated great, and this is really the way to treat your patient's concern and not just the symptom. So learn how to do GravityPhiX. Whether you're new to neurotoxins, you really can learn to do this if you take our courses and elevate your practice and be more comprehensive in your approach to your patient, get better results. If you're a more experienced practitioner and you might be doing a little bit of this, our courses will take you to the next level and make you really confident doing this in everybody like I do in my practice. And if you're an experienced injector and you're not doing this yet, you really should be able to add this pretty quickly and don't necessarily have to take a hands-on course to do this. So check out our online courses on our website. This is the GravityPhiX treatment, and I hope you enjoy. Thank you.